Tim Reha here live at the Digital Health Summit CES 2014. I'm here with Deepak Pakash with Vancive. Hey, how are you doing?
Hey Tim, good to see you again. I know I saw you last year and we were talking about Metria, which was under development, and we're really excited to be here at CES 2014 to showcase our product, which is going to be available here in the market shortly.
So you were talking about this last year, it's under development, and then you just recently launched in Europe first.
Correct, in Medica in November of last year, and here in CES we were going to make it available to a lot of our partners in the US.
How was that rollout?
It's great, a lot of excitement with the product. This is a very cool, innovative product. Let me explain what it does. Okay. It's called the Metria IH1. It's a lifestyle assessment system. So you use it to basically get insights into your lifestyle. It's a disposable product. You wear it for up to a week, and it starts collecting data, things like activity levels, your calorie expenditure, etc. So those who are interested in really changing their lifestyle, this is a good data-driven approach. It gives them good objective data to collect information, understand information, and take some actionable steps to help change their lifestyle. So here,
I'm seeing steps, calories, activity level, sleep duration. This all comes off the sensors in the pad.
Sensors, right? So you wear it for up to a week, let it collect the data, and then upload the data, and then off you go. So not only does it do sleep and sleep quality, but here I can tell you that how well did you sleep during the night. For example, here on this day, I slept pretty good for the most part, but really between 11 and 1 a.m. I was probably restless or got up or played around with my son or whatever. You can get really good information. So somebody who's interested in improving their sleep, they could look at this and say, okay, you know what, I generally sleep okay, but there are times when I don't sleep well, so maybe they can, wind down a little better, or maybe not read the iPad or Kindle until 1 a.m. or so it really gives you a lot of good information for you to take some good actionable steps to improve your lifestyle.
Yeah. So what's the target market for this? Is this retail for the customer? Is this for hospitals?
It could be. It's for health and wellness. So you could be a corporation that is interested in kind of understanding the wellness of your employees. You could be a services provider that's targeting diabetic people who need to improve their lifestyle. So it could also be for the average retail consumer who's saying, you know what, I just want to know if I sleep better or how active I am, and just get a quick snapshot. It's disposable, so if you really don't like this kind of data, hey, you've got a snapshot. You can use that information to do whatever you want to do.
So I'm curious to know, what are you looking to get out of CES? If you had one ask or a couple asks, what would you say?
Hey, this is a fantastic conference for technologies like this. Digital health, as you know from last year, it's an emerging market, but it's rapidly emerging. I mean, look at this hall here. A couple of years ago, we were in one corner, and then half of it last year, and now this is an entire hall. It's brilliant to see. A lot of devices, cool gadgets, everybody coming out with newer technologies that leverages sensors, mobility solutions, apps, trying to give consumers information that can help them change their lifestyle. But because at the end of the day, the health of the consumer is at the heart of everything that people are doing here. So this is a fantastic conference.
So Deepak, how do people get a hold of you?
They could go to www.averydenison.com and look up Vancive Medical Technologies. Alternately, they could also Google us at Metria Informed Health.
All right. Well, hey, thanks so much for being on the show this year, and we'll see you up at the after party tonight.
Hey, thanks, Tim. See you there, and see you next year.